Count the prescription bottles in your cabinet right now. Go ahead, I'll wait. If you counted 5 or more, your body might be dealing with something your doctor hasn't had time to fully explain. About 44% of adults over 65 take at least 5 medications daily. And here's what most don't realize. The same pills that worked fine 5 years ago might now be building up in your system like cars in a traffic jam. In a few minutes, I'll share the one question you can ask your pharmacist that triggers what's called a medication reconciliation, something that could catch dangerous interactions others might miss. But first, you need to understand why this matters more than you think. Here's something that caught me off guard when I dug into the research. Your risk of adverse drug reactions doesn't just increase gradually with each new medication. According to research in clinical pharmacology, it jumps from 13% with 2 medications to 58% with 5. And if you're taking 7 or more, that risk hits 82%. Think about that. 8 out of 10 people taking 7 pills will experience an adverse reaction. Not might, will. But why does crossing that 5-pill threshold matter so much? It's not just about the pills themselves. Your kidneys at 70 process medications about 30% slower than they did at 50. Your liver too. So that blood pressure medication prescribed 10 years ago, the dose that was perfect then might now be hanging around in your bloodstream way longer than intended. The medical term for this is polypharmacy, taking 5 or more medications regularly. And it's become so common that nearly half of all seniors now qualify. We went from about 1 in 4 older adults dealing with polypharmacy 20 years ago to almost 1 in 2 today. That's almost a doubling in less than 2 decades. Now here's where things get genuinely concerning. Research shows that up to 35% of older outpatients will experience what's called an adverse drug event. And for those hospitalized, it jumps to 40%. These aren't just minor inconveniences. Studies have found that polypharmacy was associated with higher risks of hospitalization and serious health complications. Let me be clear, that's not from the diseases being treated. That's from the medications themselves. You know what really got my attention? The Cytochrome P450 system. Sounds complicated, but it's basically your liver's drug processing factory. Many common medications, statins, blood thinners, some antidepressants, they all use the same processing pathway. Like trying to fit 5 lanes of traffic through a 2-lane tunnel. Something's gotta give. And orthostatic hypotension, that dizzy feeling when you stand up too fast? Multiple medications can trigger this, especially blood pressure pills combined with diuretics or certain prostate medications. Studies confirm that taking 4 or more medications significantly increases your fall risk. Not just trips and stumbles, serious injury-causing falls. Here's the part that honestly makes me angry. It's called Cascade Prescribing, and it works like this. You start taking a medication. It causes a side effect, maybe stomach upset or dizziness. Instead of recognizing it as a side effect, your doctor prescribes another medication to treat this new problem, which causes its own side effects, and round we go. Research has found that many older adults are taking at least one medication that's not clinically indicated. These aren't vitamins we're talking about. These are prescription drugs with real risks. By the way, if you're managing multiple medications, a good pill organizer with AM/PM compartments can help prevent double dosing. I've linked some reliable options in the description that many viewers have found helpful. The Beers Criteria, and yes, that's the actual name, is published by the American Geriatric Society and identifies potentially inappropriate medications for older adults. It includes dozens of medications that most older adults should avoid. Benzodiazepines for sleep, long-term proton pump inhibitors for heartburn, certain anticholinergics that increase what's called your anticholinergic burden, basically how much these drugs mess with your brain's acetylcholine, which you need for memory and thinking clearly. Ever wonder why you feel foggy or confused sometimes? The anticholinergic cognitive burden scale actually measures this. Multiple medications with anticholinergic properties, and these include common allergy pills, bladder medications, some antidepressants, can literally add up to cause confusion that gets mistaken for early dementia. So what can you do? The answer isn't to stop taking your medications. That's dangerous. But there's something called deprescribing that more doctors are starting to embrace. It's the careful, supervised process of reducing or stopping medications that might no longer be helping you. Research has found that patients on 5 or more medications faced a much greater risk of experiencing an adverse drug event compared to those taking fewer. And studies suggest that when medication lists are carefully reviewed, doctors often find drugs that may no longer be necessary, especially in patients taking multiple medications. The concept of potentially inappropriate medications is gaining traction. These are drugs where the risks likely outweigh the benefits for older adults. And here's what your doctor might not have time to explain. Medication reconciliation. A complete review of everything you're taking can identify these problems. But it takes time. More time than a typical 15-minute appointment allows. Remember that question I mentioned? Here it is. Next time you're at the pharmacy, ask, can you do a medication review to check for drug-drug interactions and potentially inappropriate medications using the current Beers criteria? Many pharmacies offer medication review services, and Medicare Part D includes something called medication therapy management for eligible beneficiaries, but they rarely advertise it. This review looks at everything: your prescription medications, over-the-counter drugs, supplements, even certain foods and drinks that can interfere with medications. They'll check for duplicate therapies, where you might be taking 2 drugs that do the same thing. They'll look for medications that have become inappropriate as you've aged, and they'll identify dangerous drug-drug interactions your individual doctors might have missed. The 5-pill threshold isn't a magic number. Some people genuinely need more than 5 medications. Others might be over-medicated at 3. What matters is that each medication earns its place on your list through current, clear benefit that outweighs its risks. Before we finish, everything we've discussed today is for educational purposes only. It's not medical advice, and it's definitely not a substitute for talking with your own doctor. Your situation is unique. Your doctor knows your complete health picture, your medical history, all your conditions. Use this information as a starting point for that conversation, not a replacement for it. Never stop or change medications without medical supervision. What's your experience been with managing multiple medications? Have you had that medication review done? Let me know in the comments. Your story might help someone else advocate for themselves.